Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week as we continue our conversation on pain. And we're coming off a week where I've set you up, kind of did a introductory program on psychological stress and how that's going to basically bleed into the pain conversation. Psychological stress we defined as a basic imbalance to our body's normal homeostasis or balance from a physical, nutritional, and psychological perspective. And today we're going to be taking a look at the author that I've been using for this multi-part series, Barry Sears, PhD. Dr. Sears is a published author and someone who you could certainly look up at Amazon.com and such, and written the Zone Anti-Inflammatory Lifestyle Management Program. He also has number one on New York Times bestseller list called The Zone. And his books really focus, and his writings focus on inflammation, which you guys have heard me now. I'm in my 70-something show here, and pretty much every week I talk about inflammation to a certain degree. So Luke 1:37, for with God nothing's impossible. Remember, guys, this year we're equipping ourselves to become better knowledgeable, to make better decisions. And we're doing that through being literate, being better literate in a subject matter that God provided us, which is physical, nutritional, and psychological health. So let's take a look at this thing that lies between our ears and say to ourselves, well, how does stress negatively impact my physical being, drive many chronic diseases like type 2 diabetes, obesity, high blood pressure, osteoporosis, heart disease, stroke, these types of things from an inflammatic perspective and a stress perspective. Inflammation inside the body will have a negative effect on us and produce disease when that inflammation is coupled with stress. Now, there are good forms of stress. We need stress in our lives. Our bodies respond to stress. But years and years of inadequate management of stress lead our state of health into a state of chronic illness. So, Alzheimer's disease is one of these diseases that everybody seems to be studying right now, and for right reason, because the escalation of Alzheimer's and dementia, the amount of it, right, in our society has really escalated. So when you think of the mind, the brain, this is truly the last frontier of medical science. When you look at the knowledge we have of heart, kidney, liver, musculoskeletal system, these are systems we greatly understand. Yet neuroscience is right now under the magnifying glass in so many different ways because the unexplained mysteries that the brain contains, researchers are just truly humbled to some degrees by the complexity as they try to understand how to speak, how do we experience love, how do we learn to hate, how do we express creativity. These are just some of the things that Dr. Sears writes about. So as the researchers out there are trying to understand neuroanatomy, that's brain anatomy, spinal cord anatomy, for instance, the complexity of neurological function and brain, the subject matter for today, this neurological function and brain tissue is very sensitive to silent inflammation. So since the brain has no pain receptors, silent inflammation is extremely important because you'll never know you have it. So neurological disease, I don't know about to you guys, but to me, right, you think about it or you see people with Alzheimer's and it's somewhat terrifying to a certain degree, and yet people may have no idea their brain is under inflammatory attack, until it's too late and you have an irreversible neurological disease. So dementia, for instance, caused by Alzheimer's disease, can't be reversed. Once that damage is done, there are medications that maybe help slow down the progression of Alzheimer's. But typically, that brain is not going to return to its normal functioning state. So with that as our backdrop and understanding that neuroscience is still relatively elementary in our understanding, our best defense against brain disease, brain drain, is a strong offense. And what that means is really keeping silent inflammation under control our entire life. That means if I'm talking to mommies and daddies out there, it must start with our children. We're dealing now with the third generation. These kids are the third generation that have been raised in a culture of a highly inflammatory diet and a highly inflammatory culture. So if we think about keeping silent inflammation under control, let's go back to the understanding that food is medicine, and we need to use anti-inflammatory drugs. What are the anti-inflammatory drugs that are in our food supply? Well, high dosage fish oil is our primary anti-inflammatory drug. And I know I'm calling it a drug, it's really not a drug, but I'm using that because when we say food is medicine, and everybody kind of understands that medicine, we do understand that food is medicinal. And if we look at anti-inflammatory health and we look at fish oil, we have to understand that fish oil contain long-chain what's called omega-3 fatty acids. And these long-chain omega-3 fatty acids can cross the blood-brain barrier. That's the barrier between your blood and your brain. Okay, it's this place where in medicine, they develop medicine to cross the blood-brain barrier to work on the brain when you're treating neuro problems. Yet here are these fish oils, relatively inexpensive, and they must be high quality, which I'll get to later, fish oils that can cross this blood-brain barrier. So 60% of your brain, dry weight, is fat. So that fat, most of it comes from the DHA. There's EPA, DHA. They're two different compounds. Now, the DHA is critical for nerve conduction. It's critical for energy production in our brain. Okay, so this is like, for instance, when I was a kid, we had what happened during, when we were kids, we had cod liver oil, right? And you would run away from grandma if she brought out the bottle of cod liver oil, because they knew even back then, fish oil is brain food. Okay, it feeds our brain since our brain is fat. And in our culture, fish oil is something that we utilize. And I'll get into this because we're underutilizing it in our food supply. So fish oil is important because the lack of fish oil in the diet, and that lack of fish oil in the diet is why we supplement. So we would be less prone to develop neurological disease due to silent inflammation if we had less inflammation at a brain level through utilizing food as medicine through fish oil. Okay, so you got that? Now, we really want to take a look at silent inflammation from a nutritional perspective. I'm not saying we should be out eating cheeseburgers and french fries and drinking colas. Oh, but let me take some fish oil and it'll reverse the effect of that food. No, we want to eat an anti-inflammatory diet like we spoke about, but utilizing fish oil for brain health is very essential. So when you look at the world, countries where fish consumption is very high, like Japan, they have the lowest rates of heart disease in the world, like Eskimos do. Yet Japan was always number one in healthcare when I was in school in the 80s. Now they're number 10th in the world because we started to import our food into that country. So anyway, that's another side note. So here we know the cultures that eat a high percentage of fish have low percentages compared to the rest of the world of heart disease and neurological disorders, and yes, even depression. Okay, so there is something to this. Now, the consumption of EPA and DHA is only 5% of what it was 100 years ago. Now, think about that. The Industrial Revolution, we've completely changed our eating or our food supply. 90% of the American food budget is spent on inflammatory foods, primarily due to the fact that we've created pro-inflammatory omega-6 fats that come from vegetable oils. So we've replaced the omega-3 fats that come from fish oil with cheap, man-made omega-6 fats that come from vegetable oil. Now we consume only 5% of the healthy EPA DHA anti-inflammatory fats that we did 100 years ago. So if we couple that with the increased level of insulin, basically we're dealing with skyrocketing rates of neurological disease. We simply have too much silent inflammation in our brains that we did not have in the past. So when we look at the nutraceutical world and the making of a high quality EPA DHA, the great news is that there are some great supplements out on the market, and there are some really, really bad ones that can help raise our EPA DHA levels in our brain. Now, as we raise these levels, and obviously remember food is medicine, so we want to first take a look at the diet that we're eating, reducing the amount of silent inflammation and supplementing. We want to reverse the effects of potentially developing Alzheimer's and dementia and neurological disorders by being very proactive. We want to be proactive throughout our entire lives, and that's why fish oil is an amazing product for just about all of us, because the EPA DHA is just not in our food supply. So the brain disorders that we're talking about, and you might want to take a look at, the anti-inflammatory zone diet by Dr. Sears. Even as some of you parents are dealing with ADD, he writes extensively on ADD and spectrum disorders. And I know in clinical practice, when we take on young people with ADD, ADHD, one of the first things we look at is the silent inflammation load on the brain and removing food from the diet that is going to cause a inflammatic response. Children and young people with these types of conditions many times require more DHA and EPA as well for the brain. The DHA you need more of than the EPA. That's why I use that first. So how much should we be taking? What's the best dietary protocol for us? A lot of it depends on where we are in our lives. A lot of it depends on history. So EPA DHA I prescribe in private practice routinely, because I do believe just about every American should be on it, except for those of you listening out there. You do want to talk to your cardiologist or your medical doctors if you're taking blood thinners. When you take a blood thinner like Coumadin, EPA DHA does thin the blood, so you want to work with your doctor on using fish oil, and high quality fish oil is essential. And I'm not going to get into vitamins and supplements and where to buy them, but you really do want to seek out the best quality fish oil, EPA, DHA, in the right ratios that need to be taken. So as we look at silent inflammation, and we look at, for instance, the fact that so many kids are on Ritalin, which basically is used to, obviously to in the brain to allow increases of dopamine in the brain. EPA DHA does that. It raises the dopamine levels in the brain, which is why it's so advantageous to use with someone with ADD and ADHD. So let me come out of that subject matter, and we're talking about silent inflammation, psychological stress. I gave you an example of how something like fish oil can be used medicinally and used as food as medicine, and that is because man has just destroyed our food supply in so many ways by removing the healthy fiber, B vitamin content, things like phytochemicals, cancer-fighting nutrients that were in our soil have been removed. We have utilized done a poor job with our ecology or the way we farm. And one of the things that we've done is, we've replaced healthy long-chain omega-3 fatty acids like EPA, DHA with cheap highly inflammatory omega-6 fatty acids like vegetable oil. So as you look at your cupboards and as you go shopping this week, we're going to be looking at replacing the bad oils with the good. Mary Eng, E-N-G, who is a PhD, is the world authority on fats. I highly recommend that if you'd like more information on learning about fats, you could browse some of her materials. She's fantastic. So as we look at psychological health, and here we are now, we have to use the noodle between our ears. We're using food as medicine. We're removing the inflammatory food, and we're looking at things like EPA, DHA to reduce the amount of inflammation. Now we've taken apart the nutritional and the psychological. When we talk about psychological health, we have to circle back to maintaining healthy hormonal balance in our bodies, because the hormones, particularly like the thyroid, can dysregulate and cause pain. So we're going to end this week's show. We're going to go into that next week. But hopefully you learned about EPA, DHA today, psychological health, or we talked about neuroanatomy today. And let's stop there, and we'll move on next week and continue our conversation on pain. You've been listening to the By Design radio program with me, Dr. James Proodian. Thanks for joining me this week. If you want more information about Proodian Healthcare, please go to ProodianHealthcare.com and become a blog member. I blog every Wednesday. Let's keep the subject matter flowing. Let's keep our health journals going, and have a blessed week.